So, and there's a lot of different of these Lyme organisms. There's a lot of different ones, hundreds of them. Different, they're a little bit different, each one. Now this is something that's very interesting. Bacteria, you know, if someone has repeated urinary tract infections and the doctor gives them the same antibiotic each time, the bacteria are able to get from other bacteria little pieces of information which allow them to be resistant to the new antibiotic. So the antibiotic can't get in, or there's a blocking protein, and the antibiotic doesn't work. And the average bacteria has, these little things are called plasmids. It's little pieces of DNA that bacteria can trade with each other. And Lyme has more plasmids than any bacteria ever discovered. And it has a lot of ways to evade our body's immune system from killing it. So it can hide in cells. It can go dormant. It can be where it puts a coat around itself so that the immune system doesn't see it. It can block antibiotics. It can hide in biofilms. I'll show you what biofilms are in a minute. So it's tricky. And that's why the treatment has to be quite global in order to really get at it and get all the places where it can hide. Now, this, do you guys, have you heard the term biofilm? Okay. If you take a sink, put a couple inches of water in it, and let it sit for a few days, and then take your finger and wipe around the edge, you'll feel this kind of waxy stuff. That's biofilm. Now, how did it get there? It got there because the bacteria that are at the edge of that sink protect themselves by putting around sort of a mucus protein coat around themselves to protect themselves so that they can hide in there, okay? The plaque on teeth, let's say you don't brush your teeth for 24 hours and you take your fingernail, scrape the back of your teeth, you get that little waxy stuff. That's biofilm. That's what plaque is on teeth. It's biofilm, okay? And the bacteria hide in there, and then if you don't get it off every day, the acids that they produce could break down the enamel, and then you can get cavities. That's how it works. Now, on a dark field, so if we take a drop of blood from a person's finger and we put it on a dark field, and we look, oh, next slide, sorry. And we look at the dark field, the white circles are the red blood cells. Oops. But you see that meshy stuff in the middle? That's biofilm. Now, if you had a very high-powered microscope and you could go in there and open it up, you'd find hundreds of organisms. It's actually like a cooperative colony. There might be parasites and bacteria and other things in there where they have this little cooperative community, they've surrounded themselves, and they're in the blood, and they live. And if you give someone with Lyme, with these kinds of things, an antibiotic, it won't get through the biofilm. And so you won't get a cure. Because those guys are in there. And they can come out afterwards, once the treatment's done, and you don't get anywhere. So if you get Lyme very early, before it's set up all this stuff, you can get, like my grandson. But once this has been going on for a while, the treatment of Lyme with antibiotics, in my opinion, is almost worthless. Because you see people on multiple antibiotics. Some of these regimens are like 5 antibiotics at the same time for years and years and years. And people don't get cured, and they don't really get better. And the antibiotics wreak havoc on the rest of their body, their gut, and their own, their own mitochondria, the things in the cells that make energy, are ex-bacteria, and they get hit. And it's just not the right thing to do. So we have to do other things if we're going to make this go. Now, there is a lab in Phoenix which has a way to stain, it's a fluorescent stain, Lyme-type organisms. And you see the glow? So this is a UV light, and there's a protein that's added to the blood, and it's mixed up. Now, if the protein, these are antibodies, these are proteins that will bind with Lyme. If they bind with the Lyme, it shows brightness. Normal on this is it's all black. It's like that. So this is one of the ways we use to identify Lyme because it doesn't depend on an antibody. These things will bind, these proteins will bind, and you can get this fluorescent positive, and we can say, yeah, you got Lyme. Okay, the antibody's negative, it doesn't matter. You got Lyme, we see biofilms in your blood, we see organisms in your blood, you got it, and we can go ahead. Now this same lab, when they took apart this biofilm, they found multiple organisms. These are all the, you can't see this, but these are, 18 organisms that are in that biofilm. They're not all Lyme organisms. There are other stuff too. Okay, now, here's the thing that I think is the most important. There is a laboratory now that is able to detect as few as 10 Lyme bugs in a body. So it's really sensitive. So they did an experiment. They took 100 people off the street in Colorado Springs, Colorado, and they took them to a massage place and they gave them deep tissue massage for an hour. So all the painful points, they rubbed them. It's like a Rolfing session if you've ever had one. It hurts like hell. Okay? Well, what they were trying to do is free stuff up where it was stuck. And then they had them pee in a cup, and they took the cup and they ran the test to see were there Lyme organisms in the cup, and 90 out of 100 were positive for Lyme. These were people who weren't diagnosed, they weren't necessarily symptomatic. I'm telling you, it's everywhere. We all got it in us, it's around, but if you have other stuff going on, it could get you. Okay? So sometimes it's genetic things where you don't, your immune system doesn't activate right. We call it methylation defects. People have deficiencies of amino acids and vitamins and minerals, and they might have chemicals or heavy metals or pesticides or EMF sensitivity, or they're on a lot of medications. They may have other co-infections in their gut with bacteria or funguses or parasites. So there's a load. There's a big problem now in many communities where there's mold in homes, and the mold puts out toxins, and we breathe them in, and these are big immune suppressors. And so we're in this environment where we're being challenged all the time with this various load of stuff, like number 5, hormone deficiencies, number 6, dental problems, gut issues, and the Lyme is just one of the things that piles on. And most people who have good handling of their, they have a handle on their genetic weaknesses, nutritionally they're stable, their gut is stable, dental problem, they don't have root canal teeth and deep pockets in their gums, and their general health is good, they don't ever really become symptomatic with Lyme. You've got to have all this other stuff at the same time. Not all of it, but enough load where it's it takes you down, and then the Lyme kind of could be part of the picture. Did you follow me? Okay. Now I just want to show you one of these because this comes up all the time. I don't think you can see this, but there used to be a laboratory where we could check people if they had root canals to see if the root canal was actually still infected and causing their body a problem. And this laboratory, the doctor was able to take a cotton pledget that was real stiff, and they could stick it in underneath the gum to the root tip, pull it out, do a neutral tooth on the other side, like a non-root canal tooth. And it would go to the University of Kentucky, and they would take that thing and they would do a bioassay. They would analyze the toxins in that thing, because these bacteria cause severe toxins. And this was a patient who had chronic fatigue, and he had a root canal tooth, and I sent it. And these 6 enzymes, enzyme assay, phosphorylase kinase, phosphorylase A, pyruvate kinase, these are the enzymes in the cell that are responsible for cellular energy. If these 6 enzymes aren't working, if they're blocked, the cell doesn't make energy. If the brain cell doesn't make energy, you're going to have memory problems, or you can't think straight, or you can't sleep, or you can't, you're spaced out, or you might be depressed. If your liver has trouble with energy, you're not going to detoxify, you're not going to make proteins. So depending on where the hit is, you may have different symptoms. If it's in your heart, you might have arrhythmias. Your heart you might get a heart attack. I mean, it just depends on where the thing hits. On this particular patient, looking at the inhibition of these enzymes, all the X's are in the 5, which means that it was severe. 93% of the activity of those enzymes was blocked by these bacterial toxins. Now this guy's got chronic fatigue, and he gets really tired, and he can't move around. He's got to stay in bed all day. And he's actually one of the brightest people in the world. Okay, he's one of these like 190 IQ guys. And he can't think for beans. And he was being poisoned by a bad tooth. So I said to him, we got to get rid of this tooth. How can I part with my tooth? Well, it's killing you. So these are sometimes problems that come up in people that we have to solve, because we got to unburden them, got to unload them, because they have too many things. You follow me?
Did you say that this test is not available anymore?
No. Again, politics. Okay. So now what we do is I send him over to a dentist, and he does a CT scan of the teeth. And usually when we see it, when we have this kind of thing going on, there's an abscess there. There's a visible abscess on the CT scan. And if he calls me and says, hey, there's an abscess there, I say, pull the tooth. Because I can't get this, but it's working out just as well. Okay. We use an energetic muscle test on this, and when the muscle test is positive, last year, my percentage when the muscle test was positive, and I sent it over to get the x-ray, with the question of, do you see any root canals with abscesses? That the success rate is between 98 and 99%. So if I get it on the exam, it's going to be there almost always. There's occasional ones that aren't, but it's almost always. So if the person has any kind of chronic illness, they've got cancer, they got Lyme, they got chronic fatigue, they got Parkinson's, they got MS, they got one of these things, the teeth are like the most important thing to get right. Because they're very close to the brain, the toxins go into the brain, and they just make the brain not function right. It's really important.
Is this something where you'd send them to any old dentist? Or
No. About 5% of dentists have CT scans in their office. So you want a natural dentist with a CT scan in their office, and there's one guy in town. So you want to go see that guy. His name's Rudy Jarrell. He's over on what's the street? It's right over by us. Myrtle and Turner, or Myrtle and, it's right over there. So I have an arrangement with him where I just write the prescription. The person doesn't need an appointment. They just go in there, they do the scan. He calls me 3 days later, and he says, oh yeah, root canals at teeth 14 and 16, both of them abscessed. And then I call the patient and say, you got 2 abscesses, go back over there, get the thing taken out. It's very important how it's removed too. It has to be done right. It has to be really cleaned out. He ozonates it. Once the tooth is out, he puts some stem cells in there from you, so take some of your blood, put stem cells in there, close it up, and then you get good solid bone, the thing heals up, and it won't bother you anymore. And then later on you can get a bridge, or if you're doing really well and you want to chance it, an implant, but they're just really important honestly, the people that I've taken care of who are really sick, I have found that if this doesn't get handled, they don't get better. They just don't get better. It's too much of a load. Okay, let's see what's next here. Oh, I just want to just go back one thing, that this is also very interesting. Saw one of these today. Whoops. If you recognize this guy, he's a very famous singer in Mexico. He's a great guy, and he's got a lot of fillings in his teeth. And if you put, what happens if you put two separate metals in a salt solution?
Potential.
You get current flow. What's a car battery? Zinc, lead. The lead pulls better than the zinc, and the zinc electrons will go to the lead. That the electricity is a flow of electrons through a conductor. So the conductor is salt water, and the zincs move, that's electrons. And if you put something here, it'll feed those electrons around and you will get a current. A nerve cell fires at about 70 millivolts. So I say, I think the thought, lift my arm. The thought that I think puts an electrical current in the nerve cells over here that, come on in, that stimulate the nerve to contract the muscle to lift my arm. At 70 millivolts, it fires. So if you look at that, this is a Radio Shack $20 voltmeter. And I put one electrode on the tooth and one electrode on the gum. And he's got, I don't think you can see it, 241 millivolts of current 24 hours a day going through his nerve from his jawbone into his brain. That was only one. He had like 6. And he was having trouble with his body. So this isn't good for the brain. You know, if you think your phone is bad, it isn't close to 240 millivolts going 24 hours a day, implanted in your jawbone, going at your head. So these things are bad, and this is also part of the problem. That we, you know, the toxicities aren't just from outsiders. A lot of times they're sitting right inside of us. So these are things that need to be handled at some point so that the health can be restored.
Now it sounds like if you got root canals, you should just go ahead and have them out.
Well, usually that's true. Usually that's true. It's not 100%, but it's common enough, especially if you have health problems. If you got health problems, this is another interesting study that was just published. They took men and women that had fatal heart attacks. So the guy had a clot in his heart artery and he died. And they did a post-mortem. And these were people who also had root canals. So 2 things, heart attack, fatal, and a root canal tooth. And at post-mortem, they dissected the heart artery and they took the clot out. And they did a very specialized test on the clot to see what bacteria were in the clot. And then they pulled the root canal tooth, and at the abscess at the base of the tooth, they took some of that and they did the same test to see what bacteria were in the abscess at the root of the tooth. And there was a 75% match. These bacteria got into the bloodstream and went into the heart and caused the clot that killed the person. Now, it's been known for years in cardiology that gum disease predisposes people to coronary artery disease because these bacteria get out and they get in the artery wall and they block stuff up. It's also true of root canals. Okay? This is another big problem in this country with children. Vaccinations have toxic amounts of formaldehyde, aluminum, many of them have mercury. It's another toxin. So you give a brand new newborn baby on day 1, hepatitis vaccine. Okay, a disease that you can only get by sharing blood with an infected person. That means either you're sharing needles as a drug addict or you're going to give them a blood transfusion. Or they're going to have sex with bloody fluids. That's how you get hepatitis B. Why vaccinate every newborn? Because it's a $9 billion vaccine business. And these babies get 26 of them in the first year. Okay? Why is there an autism epidemic? This is part of it. Okay, so these are the common bugs that we see. Borrelia is the original Lyme bug. Ehrlichia is another kind of bacteria. Babesia is actually a parasite, a single-cell parasite that comes in. Bartonella is the cat scratch organism. It's a bacteria. Rickettsia is a rickettsia. It's another class. It's like a bacteria. Spirocheta, another bacteria. These are like and we test everybody on these because these are the common ones, and most of the time, you got all of them. There's probably 100 or 200 or 500 more. We just don't know. Because nobody's actually going around culturing tick mouths to find what are they actually carrying and what else should we be looking for. But that would be an interesting project. Okay? A lot of people also have these viruses, which they picked up when they were kids, and which are supposed to be just quiet in the body, sleeping, never bother you again. But when you get the load going up, these guys wake up too. So Epstein-Barr, cytomegalovirus, herpes type 1, type 2, type 6, type 7. VZ is chickenpox. You probably all know someone who's gotten shingles. What's shingles? It's chickenpox. The guy got chickenpox when he was 4 years old, and now he's 60, and his immune system is down, and his nutrition is down, and then he gets the rash here with the pain and the blisters. He didn't get that from somebody new. That's been in his body since he's 4 years old, and it reactivated. And all these guys do the same thing. And then people get antibiotics, and so they get candida. Yeah. Okay. So these are other just infections which are part of this thing. I'm not going to show you all these organisms. That's Bartonella. Bartonella produces a rash in these people, and you've probably seen people, or possibly it's happened to you, where you had a big growth spurt, or you gained a lot of weight, and you got these stria. But in Lyme disease, this is Bartonella. You can scrape that thing, and you can see the organisms in there. They're in there, and they cause a breakdown of the skin and the elastic tissue, and they cause these stria, and they're red. I want to just go back. One of the strategies that we use in terms of treatment is to use ozone. Now, ozone is nature's natural healer. It's oxygen. Now, when we breathe oxygen, it's O2. Ozone is O3. It's naturally made in the environment when lightning hits O2. The high electrical current splits the O2 into O1s. O1s are very unstable. They will bind to O2s and you get O3. Why does it smell fresh after a lightning storm? Because these O3 molecules have a light negative charge. They bind all the particulates in the atmosphere, and then when it rains, they all get cleaned up. So ozone can be used in the body. It's got a negative charge. The surface of these organisms, bacteria and viruses and fungi and parasites, have a positive charge on their outside. So when you add ozone, it hits them. And that positive charge attaches to the bacteria and fractures it, and it breaks it open. Now, ozone is very powerful and very effective. If you look on the right-hand side, or left-hand side, if you took 450 bacteria and you put in 400 or 4,500 molecules of chlorine, which will kill bacteria, bleach, it takes a while for it to kill them. If you look at ozone, one molecule of ozone will kill 4,500 bacteria in a second. So we can introduce ozone into the blood, and it will go into the biofilms and dissolve the biofilms, and expose the bacteria and kill the bacteria. And we generally see, after 6 or 8 weeks of ozone treatments, if at the beginning visit we see biofilms and we see spirochete organisms in the blood, that that after 6 or 8 weeks we don't see biofilms and we don't see organisms. Like we're getting there, we're moving this, okay? She just told me to hurry up, so let me Just want to show you. For those of you that make your own homemade silver, don't waste your time. These are a variation of silver products, homemade and otherwise. There's only one brand that's any good. It's the Sovereign Silver or a Gen 23. This is a true silver micro stuff. We can give this IV. This is just clumps. Had one lady last year that was making her own homemade silver. She came in, I wasn't sure what race she belonged to. She looked somewhere between black and white, but I didn't know what. And I asked her, I said, you have kind of an unusual color. What's your nationality, or what were your parents? And she said, well, she had a very strong Southern accent. She was from Alabama. She was a nurse. And she said, I did too much homemade silver. And I have Argyria, which has made her skin blue. It's literally blue. Okay, you don't want that. These things will do that. This other product will. Let me just. This was a kid, this is just to demonstrate a couple of the characteristics that we see. This was a kid who was 19 years old and he came in from Arizona with his mother. And he looked like he was, you know, the gothic stuff that these kids go through? Black everything, big ear, you know, the earrings where the ear is, looks like they came out of Africa, you know, where the whole thing is stretched out. And he was just like this. He wouldn't talk to me. His mom, you know, shipped him here from Arizona. And she said, he's got Lyme, but we've been everywhere, and he won't talk, and he's like terrible. Okay, so I said, okay. And I didn't finish the exam the first day, and I said, I need to see you back tomorrow because I need to finish the exam. And on the second day that he came back, he came in and showed me this. Now, that was a new tattoo that he'd gotten the day he came to Clearwater. And that is a tick with a big Bowie knife stuck through the tick. And the Bowie knife is holding an IV bottle with the IV stuff running into the tick. It took up his whole calf. Huge amount of dye and color in the top. And I said, what are you doing? Like, you're toxic. Now you just added another bottle of ink to your load? All these inks are full of mercury and cadmium, and, you know, that's how you get the color in them. Well, he said, I don't know. I was excited about the treatment, and this looked like the right thing. So I looked at his mother, and I said, what were you thinking? And she said, well, I don't know. I got one too. And she, big eagle across her chest, okay? All right, anyway, he got back. And what was funny is, he was here, I think, about 3 months, 3.5 months. By the end of about 3 months, he was actually talking to people in the IV room. He undid his black hair dye. He took out his earrings. And I sat with him. You know, all these abnormal labs, like all the stuff I was talking about. He's missing this and missing that and missing this and missing that. Now here's him at the end. He looks like a normal, he's 16, and I was talking to him, and I can't play the video because there's a beautiful video of him talking. Like he was sure he was gonna die, and he knew nothing could help him. And the feeling he had was he could not get into his body. His body was so horrible that he just wouldn't even want to be near it. And that now he could be in his body. And the thing he was most excited about was that he could go home and take his driver's test because he wanted to be able to drive. And he was like a normal, nice kid. So sometimes your crazy kids aren't just crazy. You know, they got stuff wrong with them. And he had really the Lyme had affected his brain. And he couldn't think right. He was doing all these self-destructive stuff at the same time. So, there's another kid, another same beautiful story. This lady's 48. She's got a PhD in engineering. She comes from Poland, I think. PhD in engineering from Ohio State University. Can't walk, can't do anything. And at the end, she's playing tennis. Okay? Rheumatoid arthritis was her diagnosis. She's a Lyme case with everything else. Oh, I want to show you some of these. There's some biofilm, and then there is an infected red blood cell. See the bumps on the surface? Those are Lyme organisms parasitizing the red cell. See that thing coming out? That's a spirochete coming out of the cell, or going in. I'm not sure which direction it was going. So you can see this stuff, and it's, you know, it's there, and it's very helpful. This is that same patient after treatment, okay? The red cells are nice and round, they're not overlapped, they look beautiful, there's no biofilm. So you can follow this and you can see the progress.
Doctors used to use like enzymes to get rid of the biofilms, right?
Well, you can use enzymes. Ozone works really well. If you give ozone, it really handles the biofilm. So, all right. Sometimes the seas are stormy, but if you do everything right, you get a good outcome. Good. Now, a few minutes for questions.
We just kind of have a private question.
What's that?
Okay, we just kind of have a private question. I'll try to set it up as best possible.
Yeah.
Well, these protocol that you use for treatment, is it always the same, or it's tailored?
No, because the organism load that each person has is different. So it's an individual diagnosis of, look, here's what your load is. We're going to work on you from the point of view of your load, because the next guy's got something different.
Are there studies in this country or other countries in Europe or anywhere that show the effectiveness of this other than the anecdotal?
There's about 2,000 published papers on ozone as therapy
For Lyme, or just
for various infectious diseases and for other stuff. And if you go to ozoneuniversity.com or you go to AAOT.US, that's the American Academy of Ozone Therapy. So there's now an organization where doctors are certified to deliver ozone therapy. The national meeting starts Thursday. I'm flying there tomorrow to be there. Ozone can be used in joints for pain. It can be used in bladders for chronic cystitis. It can be used for lots of different things, because it basically is it's an antidote to about everything. So it's ozoneuniversity.com or AAOT.US are two good places where you can read up about it. There's now a board certification in the US for it. And so doctors are being trained to deliver it safely. It's a very safe therapy. We do in the neighborhood of 7,000 to 7,500 ozone treatments a year. We have for 8 years. Nobody's ever died. Nobody's ever gone to the hospital. We've cured infections that when I was an infectious disease doctor, you couldn't cure. Had a guy with a fungal infection of an artificial knee joint. Now, you can't cure that with antibiotics because the biofilms get on the surface and you can't cure it. And he was recommended by his orthopedic surgeon to have the old knee replacement taken out and new one put in, which if you've ever had a knee replacement, you'll never do it again. It's a rough operation. We cured that with a combination of IV silver, IV ozone, local ozone injected into the joint, and we cured his joint infection.
are you claiming the cure for chronic Lyme?
No, because I can't claim anything, and I can't be sure that the patient is going to do what I tell them. So we have about an 85% success rate. 85% of the people that we see will get better from the things that they come in with, based on their own testimony and lab work that we do. So, there's nobody, you can't cure, it's against the law to cure. So we don't claim cure, but we claim help. And with the right approach, most things you can help people. And the treatments are non-toxic and they're non-harmful. So we're sort of in line with Hippocrates, we're doing no harm. but we are doing good. But it takes a motivated patient who can afford the treatment, because the insurance companies aren't gonna pay for this stuff.
So you offer an extensive dietary plan as well?
Yes, it's a very important part of the whole picture of what you eat, what supplements you take, what treatments we do in the clinic.
So that's on the patient, that becomes something that the patient has to be responsible for, is there?
Yeah, I mean, they gotta take it, they gotta do it, and then we got a good chance. You know, some people are so far down the line that, you know, sometimes you can't do it. But
Now, with O3, it causes oxidative stress to other cells, and there's kind of a collateral as well.
well, this is interesting. At the right dose, O3 is a performance enhancer. We have pro athletes. I'm an athlete. I raced 2 days ago, St. Anthony's Triathlon. I'm interested in performance. I want to be as good as I can get. I want to win my age group at every race that I go to. On Sunday, I got second. It's very competitive, like the best guys around are there. And O3 is a performance enhancer. And if you have bugs, it'll get them, but in your own cells, it makes your cells work better. It actually makes your mitochondria more efficient and work better. So it's really, it's the nature's antidote to about everything. It's just remarkable stuff.
But you can't inhale it.
Those
Don't
are the
want to
kind you
breathe
can
it.
buy in a can like
Through
that?
the lungs, you can't do it. But if you put it through olive oil, you can breathe it. We put it in ears for sinus infections, for tinnitus. People have tinnitus and they can't hear. About 7 out of 10 with 10 treatments in their ears with ozone, they'll say their tinnitus has gone way down or gone. Yeah, so these are things that, you know, you can't guarantee in any one person, but usually with the combination of stuff, you can definitely make improvements.
The last doctor I told me said, so don't even bother, there's no cure for diabetes.
Right. I think the problem with the medical profession today is if the guy doesn't know about it, he doesn't like it.
And he said,
Okay?
frequently he'll say, well, there's no cure, but he
That's
could be saying, I don't know.
And what he's probably truthful about is if I treat you with what I know, it won't help you. And he's being honest in that. But there is a lot broader way to look at health and handling health than through a strictly pharmaceutical model.
I've heard some doctors say that they suspect that all mental illness might be Lyme related, so especially elderly stuff like dementia and Alzheimer's and stuff. Would it make sense to?
I don't think it's just
somebody
Lyme.
like that?
I think it's cytomegalovirus and mycoplasmas and other stuff, and it's bad teeth, and it's other toxicities. I had a girl last year, 12 years old, out of school 9 months, can't get out of bed, exhausted all the time, can't think. Was everywhere. University of Florida, everywhere. They put her on psych drugs because they thought maybe she's just depressed or whatever. Didn't work, and parents took her off. We ran a toxin screen on her, an environmental toxin screen, which I do on every patient that comes in. And we found that the pesticides and plastics and styrofoams and flame retardants and this whole group of stuff that we're exposed to all the time was like none. One thing was really high, and it's a gas additive called MTBE. It boosts octane. It's in all the gasoline that's being burned. And normal is under 200, and hers was 39,000. And the lab called me and said, what is this girl doing with gasoline? So when the parents came back in, I said, what is this girl doing with gasoline? Is she sniffing gasoline? Is she trying to get high? What is she doing? And they said, well, about 2 years ago, she decided that she was going to be the next Danica Patrick. She was going to be a race car driver. And they had enrolled her in a training course on weekends, 2 to 3 hours each weekend, driving midget race cars. And the track area was relatively enclosed, and she was breathing the fumes, and she got the fumes, and her level went sky high. And we had an answer. And she recovered once we were able to detox her of all these fumes and keep her off the track and just get the exposure down. So these things are sometimes, it's not a one thing. I was at an Italian restaurant, and the spaghetti sauce was just like amazingly good. And so we called the chef over and said, got the maitre d' to call the chef over, what do you put in this tomato sauce? This is just incredible. And he said, well, there's 10 things in that spaghetti sauce. There's special tomatoes, and there's special olive oil, and there's special Parmesan, and there's special or garlic, and there's, he names off all the things. And he said, if I took one thing out, it wouldn't be the same. So I tell people, you are tomato sauce. What's wrong with you is tomato sauce, okay? You got 10 things or 5 things or 8 things, and that's what's giving you the symptoms that you have. And yours are different, and yours are different, and mine are different, because our tomato sauces are all custom tomato sauces. And if we then, so my job is, okay, what's in the tomato sauce? Because if we can figure out what those things are, we can pull those things off. And then the burden that the body is trying to control things under gets better, and health gets improved, restored, maybe even healed. Okay? Good. She just gave me the sign. Thanks for your attention. I hope this was interesting for you. Obviously, we take care of Lyme patients and anything else that nobody else can solve. And we're really good at it. And most doctors don't like these kind of cases because they're complicated and they got 5 minutes with you. And I love these kind of cases because I like problems and I like debugging these things because it's fun to figure it out and have someone who's got a negative rheumatoid factor and a negative ANA and a normal sed rate and have her go back and say to me, I feel great. So that's what I look for. Okay? Good.